Imagine taking a polygraph test, a lie detector.
Right.
But instead of being hooked up to a machine that's just covered in wires and sensors, it's the year 1000 CE.
Wow. Okay, setting the scene.
Yeah. And the examiner is simply sitting right beside you. He's just holding two fingers against your wrist, and he's using literally nothing but the rhythm of your own pulse to uncover the deepest secrets you're trying to hide.
It's such an incredible image, honestly.
It really is. So today we are diving into a single, incredibly illuminating source that challenges, well, basically everything we're taught about the origins of psychology, mental health, and how your mind and body actually interact.
It's a really profound piece of history we're looking at today. We're exploring the life and work of Abu Ali al-Hussein ibn Abdullah ibn Sina.
Which is quite the name.
It is, yeah. But in the West, you probably know him as Avicenna.
Right, Avicenna.
Exactly. He was born around the year 980 CE near Bukhara, which is in modern-day Uzbekistan. And our mission for this deep dive is to discover how this one polymath mapped the human mind and basically pioneered psychosomatic medicine nearly 8 centuries before European medicine even began to consider the mind and body as, an interconnected system.
Yeah, just to give you, the listener, a sense of this thinker's scale. I mean, Ibn Sina was a true titan of the Islamic Golden Age.
Oh, absolutely. The sheer volume of his work is staggering.
Right. He wrote over 400 works, including the Canon of Medicine and the Book of Healing.
Yeah, monumental texts.
And while he's often celebrated globally as the father of early modern medicine, our source material today really zeroes in on his foundational contributions to ilm al-nafs.
Right, which translates to the science of the soul or Islamic psychology.
Exactly, because he wasn't just, treating broken bones or bacterial infection.
No. He was actively exploring the very architecture of consciousness. He recognized that you just can't separate physical ailments from psychological traits.
Okay, let's unpack this. Because what we are really talking about here is how Ibn Sina provided actual empirical evidence that psychological suffering is a real, tangible medical condition.
Yes, and that was revolutionary.
It really was. And to bring this into your daily life, I want you to think about the last time you had a powerful, like a gut feeling about a decision. Or the last time you were under a massive deadline at work and developed a splitting tension headache.
Yeah, those physical manifestations of stress.
Exactly. We experience these physical symptoms of mental stress constantly. And this 11th century genius explained the exact physical mechanisms behind those modern symptoms.
And, he did it through really rigorous clinical observation. Ibn Sina was not just some armchair philosopher who was content with abstract theories.
Right, he was in the trenches.
Exactly. He was a practicing physician seeing patients every single day. He was actively looking for the biological evidence of how the mind alters the physical state of the human body.
Which brings to mind that case study from the source material, the one regarding the young prince.
Oh, yes. It's the perfect example of his approach.
It's such a wild story. So a prominent young prince is completely bedridden, right? He's emaciated, fading away, and he's suffering from this mysterious, debilitating illness.
Just fading away to nothing.
Yeah, and the most elite doctors of the era are brought in, and they are entirely baffled. I mean, there's no fever, no infection, no tumor.
Right. From a purely mechanistic perspective, the prince's body was failing for zero logical reason. Every physical diagnostic test they had just came up empty.
Nothing.
So Ibn Sina steps in, and his intervention reveals a completely different diagnostic framework.
Yeah.
He doesn't administer a potion or attempt to balance the patient's humors with bloodletting.
None of that medieval stuff we usually picture.
Exactly. He simply sits beside the young man and places his fingers on the prince's wrist to monitor his radial pulse.
Just a manual pulse check. That's it.
Just feeling the pulse. And then, while carefully tracking the heart rate, Ibn Sina begins to speak. He calmly recites a list of different districts in the city. Then he moves on to specific streets.
Just casually naming streets.
Yeah, and then he lists prominent family names. He is methodically working through the geography and the social network of the young man's world. And he's watching for a biological reaction.
And he gets one. Because when a very specific neighborhood and a particular name are mentioned out loud, the prince's pulse suddenly spikes under Ibn Sina's fingers.
Yes. What's fascinating here is that Ibn Sina used that exact involuntary physiological response to form his medical diagnosis.
Wow.
He concluded that the prince was actually suffering from severe emotional distress due to unexpressed love.
Which is just...
The clinical term at the time being al-ish, The prince's body was literally shutting down because of the overwhelming hidden psychological burden of being in love with someone he either couldn't have or, just hadn't confessed to.
It is remarkable. I mean, he essentially invented the world's first polygraph test using just a finger on a pulse.
That's a great way to put it, yeah.
Because we tend to think of biofeedback as this highly modern psychiatric tool, right? Involving heart monitors and skin conductivity sensing.
Eating machines and screens.
Exactly. Yet here is a physician recognizing that when the conscious mind attempts to conceal a powerful emotion, the autonomic nervous system is inevitably going to betray that secret through physiological changes, like an accelerated heart rate.
He understood the autonomic nervous system's response to stress way before we even had the terminology for it. But, to utilize biofeedback in that manner, Sina first needed a comprehensive theory of how the brain actually processes the outside world.
Right, he had to map it out.
He had to explain the mechanism, like how does a spoken word, just a sound entering the ear, trigger a cardiovascular response?
Well, that requires a map of human perception, which the source material details extensively.
It does.
He divided the human experience into two distinct categories. On one side, you have the external senses, which are, the basic data collectors we're all familiar with.
Right. Sight, sound, touch, taste, and smell.
Exactly.
So those external senses, they act as the hardware capturing raw data from the environment. But the real genius of Ibn Sina's model lies in what happens after that data enters the nervous system.
The internal processing?
Yes. He mapped out 5 distinct internal senses. These are cognitive faculties that operate entirely inside the brain to process, interpret, and assign meaning to that raw sensory data.
Okay, so the first of these internal faculties is common sense, or al-hiss al-mushtarak. And just to clarify for you listening, this is not common sense in the modern phrasing of being street smart.
No, not at all.
In this framework, it's the synthesizer.
Precisely. It's the faculty that combines distinct sensory inputs into a single, cohesive, conscious experience.
Like putting the puzzle pieces together.
Right. If you're holding a red apple, your eyes process the color red and a round shape. Your hands feel the smooth texture. Your nose detects a sweet scent.
Okay.
Al-Hiss al-Mushtarak takes those isolated data streams and stitches them together so you perceive one apple instead of just a chaotic jumble of disconnected shapes, smells, and textures.
Right. And once the brain synthesizes that object, it obviously needs a way to hold on to it, which leads to the second faculty, representation, or al-khayal.
Yes.
This seems to be the brain's ability to retain the mental image of the apple even after you close your eyes or put the apple away. It basically holds the data in your immediate mental workspace.
It does, yeah. And once you have that representation held in your mind, the third faculty comes into play, which is imagination, or al-mutakhayila.
The imagination.
Right. This is the active creative workspace of the brain. It's the capacity to take those retained images and combine them to create entirely new, non-existing concepts.
Oh, like taking the retained image of a horse?
Exactly. You take the horse, you combine it with the retained image of a bird's wings, and your imagination produces a Pegasus.
Okay, so we have the synthesizer, the retainer, and the creative workspace. But the fourth faculty is where, to me at least, his theory shifts from basic cognitive psychology into something much more profound, specifically regarding human survival and anxiety.
You're referring to estimation, or al-wama.
Yeah.
This is arguably his most brilliant insight. Estimation is the cognitive ability to perceive non-sensory qualities.
Meaning things you can't see or touch.
Exactly. Things you cannot physically interact with, like danger, safety, or malicious intent. The source gives this really striking example. Imagine a sheep in a field that spots a wolf.
Okay.
The wolf hasn't growled, it hasn't bared its teeth, it hasn't acted aggressively at all. The sheep's external senses only detect the shape, size, and color of the wolf.
Yet the sheep instinctively feels absolute terror.
Because the faculty of estimation, the WAM, perceives the underlying meaning of the wolf. It identifies the inherent danger, even though that danger is not physically interacting with the sheep yet.
It's like a rapid subconscious threat assessment.
It's exactly that.
And that threat assessment is then logged into the fifth and final faculty, which is memory, or al-hafisa. But from what I'm reading, this isn't just a filing cabinet for basic facts.
No, it's much more than that.
It's the storage vault for the emotional meanings generated by estimation. It permanently remembers that the shape of the wolf equates to a threat to survival.
Right. It creates an emotional baseline for future interactions.
Here's where it gets really interesting. Looking at these 5 internal faculties, it operates almost exactly like a modern email inbox system.
Oh, I like this.
Think about it. Your common sense, that first internal faculty, is your main inbox. It catches all the raw incoming messages, the text, the attachments, and formats them into a readable email.
Makes sense.
Representation is basically having that email open on your monitor.
Right, it's there in front of you.
Yeah. And imagination is you forwarding that email, editing the text, adding your own thoughts, and just playing with the data.
That's a very clean way to visualize the workflow. But how does estimation fit into this system?
Okay, so estimation is the incredibly advanced spam and malware filter.
Of course.
It reads the vibes of the incoming data, right? It scans the email before you even consciously read it, flags it as a phishing scam, and sets off the alarm bells. It is constantly assessing reality for hidden threats.
That's spot on.
And memory is your archived folder, keeping a record of all known spammers so the spam filter is even faster the next time.
That analogy perfectly highlights a crucial element of Ibn Sina's philosophy.
Which is?
That perception is an actively constructed process. The human mind isn't just a passive mirror reflecting reality. It actively interprets the world and immediately attaches emotional weight to every single experience through that estimation faculty, your spam filter.
Which fundamentally changes how we view emotional reactions, doesn't it? It means our physical reaction is not to the event itself, but to our brain's interpretation of the event.
Exactly. And by identifying that mechanism, Ibn Sina anticipated the fundamental premise of modern cognitive behavioral therapy by nearly a millennium.
1,000 years early.
He understood that it's our interpretation of reality that disturbs us. The sheep isn't disturbed by the gray fur of the wolf. It's disturbed by the fatal meaning its brain assigns to the wolf.
So if that internal threat filter malfunctions, say a person's estimation faculty gets overly sensitive and starts flagging everyday situations as mortal danger.
Which is essentially the mechanics of modern anxiety.
Exactly. How did a medieval physician treat that? If we know from the lovesick prince that these emotional states cause severe physical illness, how did Ibn Sina reset a broken system without modern pharmaceuticals?
That leads us directly to his clinical practice within the Islamic Bimaristan system.
All right, the Bimaristan.
A Bimaristan was not just some rudimentary sick house or an asylum. These were highly advanced, comprehensively designed hospitals that provided rigorous medical care, including specialized, dedicated psychiatric wards.
Wow.
And importantly, they were funded by charitable endowments, meaning care was provided entirely for free to the patient.
I mean, providing free universal psychiatric care in the 11th century is just a staggering logistical and cultural achievement.
It really is. The contrast with medieval Europe during the same period is incredibly stark.
I can imagine.
In Europe, severe mental illness was predominantly viewed through a theological lens. It was often explained as demonic possession, a moral failing, or a spiritual deficit.
Right.
Consequently, patients were frequently chained in dark rooms or subjected to putative treatments designed to drive out evil spirits.
And Ibn Sina rejected that.
Ibn Sina explicitly rejected that entire framework.
So he viewed psychiatric suffering through a strictly medical and biological lens.
Completely. These were patients suffering from biological and psychological conditions, and he believed they deserved to be treated with medical rigor, logic, and absolute dignity.
That's amazing.
He even classified psychiatric conditions in the canon of medicine with a level of detail that mirrors modern diagnostic manuals.
Yeah, the source outlines several of these classifications, and they are remarkably familiar to anyone today. For instance, he diagnosed melancholia, and he detailed it not just as sadness, but as a chronic state of persistent fear, paranoia, and severe sleep disturbances.
Very accurate to modern depression and anxiety.
And he linked this to a specific biological imbalance, an excess of black bile that he believed altered the temperature and moisture levels of the brain itself, physically impairing cognitive function.
He also extensively documented mania. He characterized it as states of extreme hyperarousal, severe agitation, and racing, uncontrollable thoughts.
Which, again, is spot on.
He identified hallucinations too, recognizing them not as visions from the spirit world or demonic trickery, but as internal sensory perceptions occurring without external stimuli.
A clear sign of neurological or cognitive breakdown.
Exactly.
He even studied nightmare disorders and insomnia, and what I found really fascinating was his explanation for them. He didn't just say, oh, you are stressed so you can't sleep. He explicitly linked insomnia to digestive health.
Yeah.
He theorized a very early version of the gut-brain axis. He believed that poor digestion created physical vapors that traveled up to the brain, irritating the nervous system and preventing the mind from resting.
It's an incredible intuition.
But wait, let me push back here for a second.
Sure.
When I think of medieval medicine, I really do think of humoral theory. Balancing bile and phlegm, which we know today is scientifically inaccurate.
Right, the four humors.
So without modern antidepressants or antipsychotics, how could he possibly treat severe crippling melancholia effectively just by trying to balance humors?
It's a totally valid skepticism. I
Yeah.
mean, he obviously lacked modern neurochemistry.
Right.
However, his core understanding that the mind and body were inextricably linked led him to an integrative therapeutic approach that was remarkably effective at regulating the nervous system.
Okay, how so?
Well, he started with a physical foundation. He prescribed highly specific dietary adjustments and rigorous physical exercise to correct those humoral imbalances.
Diet and exercise.
His logic was that you simply cannot stabilize an erratic mind if the physical body is stagnant, inflamed, or undernourished.
So you have to fix the hardware before you can debug the software.
Exactly. And from there, he utilized environmental and physiological treatments, like hydrotherapy.
Oh, interesting.
He prescribed specific regimens of warm baths, not for hygiene, but to physically soothe an overactive nervous system.
That makes a lot of sense.
The warmth dilates blood vessels, it lowers blood pressure, and physically relieves the central tension that accompanies severe anxiety.
To be fair, a hot bath as an anxiety treatment still holds up beautifully today.
It does, because it forces physiological regulation. He also employed tailored music therapy.
Music therapy in the 11th century.
Yeah. In the Bimera stands, they would play specific musical modes and rhythms designed to match and then slowly alter a patient's erratic pulse.
Wow.
He believed that the vibrations of harmonious sound could physically realign the brain's internal state. So he used rhythm to literally slow down a manic heart rate or elevate a melancholic mood.
That is wild. And he combined these physiological treatments with early forms of cognitive reframing too, right?
Yeah, yes.
The source mentions he engaged in structured, empathetic conversations with patients to help them process grief, untangle complex losses, or work through trauma.
He was actively attempting to help them recalibrate that internal estimation faculty, the one we talked about earlier.
It's a spam filter.
Yes, the Stan filter. By talking through the trauma, he was helping the patient's brain reinterpret reality so their internal threat filter would stop flagging everything as an emergency.
I mean, looking at this holistic approach, the dietary adjustments to fix the gut, the exercise, the hydrotherapy to calm the nervous system, the music to alter brainwaves, and the talk therapy to reframe trauma.
Yes.
This isn't archaic medicine. This is precisely what the most cutting-edge integrative wellness centers and psychiatric clinics are doing right now.
If we connect this to the bigger picture, Ibn Sina's methods are essentially the foundation of modern somatic psychology.
Which is the study of how trauma and chronic emotion are physically held in the body, right?
Exactly. He was practicing early psychoneuroimmunology, which is the science of how psychological stress degrades your physical immune system.
It's just mind-blowing.
Modern 21st century psychiatry uses fMRI machines, neurotransmitter mapping, and double-blind trials to prove these connections. Ibn Sina arrived at remarkably similar clinical conclusions, using acute observation, rigorous logic, and profound empathy.
So what does this all mean? When we synthesize the case of the lovesick prince, the mapping of the internal senses, and the compassionate care of the Bimeristans, the primary insight of this deep dive is really a realization about a massive misstep in modern medical history.
I completely agree.
For almost the entire 20th century, Western medicine divided the human being into isolated, disconnected parts. We basically built an artificial wall at the neck.
We really did.
You go to a physician for your body and a psychiatrist for your mind, and for decades, those two disciplines rarely communicated.
We treated the body as a machine and the mind as an abstract ghost, completely ignoring how one dictates the health of the other. What we are seeing now in research centers around the world is an urgent, massive effort to undo that division and integrate care.
Yet Ibn Sina solved that split over 1,000 years ago.
He really did.
He understood the fundamental truth that you cannot untangle the physical from the psychological. To heal the physical body, you absolutely must listen to the emotional state of the soul.
Right.
And to treat the mind, you have to care for the physical environment of the body. They are a single, continuous system.
This raises an important question regarding how we view the timeline of medical history.
Yeah.
We are frequently taught a very linear, Eurocentric narrative of scientific progress. This source serves as a powerful reminder that compassionate, rigorous, medically grounded mental health treatment didn't suddenly spring into existence in 19th century Europe.
Not at all.
Its roots run deep within the Islamic Golden Age, thriving in a civilization that viewed mental illness not as a spiritual curse, but as a human condition requiring logic, medical care, and dignity.
It really requires us to completely reevaluate the history of human psychology.
Absolutely.
Before we wrap up today, I want to leave you, our listener, with a final thought to mull over as you go about the rest of your day, building directly on Ibn Sina's insights.
A parting consideration for the modern listener.
Think about this. If an 11th century physician knew, through rigorous observation, that unexpressed emotions physically break down the body, just like they did to the lovesick prince, how many of our modern unexplained physical ailments are operating on the exact same mechanism?
That's a heavy question.
When you consider our societal epidemics of chronic fatigue, relentless tension headaches, or unexplained gastrointestinal issues, how many of those physical symptoms are simply our bodies desperately trying to sound an alarm about the emotional burdens we refuse to process?
It is a vital question to ask yourself the next time your body's demanding your attention.
Thank you so much for joining us on this deep dive. If exploring the true historical origins of psychology and mind-body medicine has given you a new perspective on how your own mind works, please consider sharing this conversation with a friend, a family member, or anyone fascinated by the true history of medicine. We will catch you on the next deep dive.